Meet Chester, an average 60-year-old man who enjoys teaching his grandchildren violin. A month ago, Chester was diagnosed with the most lethal cancer, pancreatic cancer, when it was far too late, at which point the doctor was unable to provide him with a curative prognosis due to the cancer's rapid metastasis. Little did Chester know, the cancer in his body had been metastasizing for close to 2 decades, yet it was fatally masked as abdominal pain. With only 2 to 9% of patients surviving 5 years after initial diagnosis, pancreatic cancer is thus branded as a severely understated malignancy. Unfortunately, Chester does not fall in the survival category and is now one of 430,000 people who die annually from pancreatic cancer. If there only had been a way for Chester to find out his body was cancer-stricken earlier. Well, now there is. Introducing SALiFLOW.
Hi, my name is Aithira Tope.
And I'm Anya Bhatia.
We propose SALiFLOW, a novel lateral flow-based early diagnostic tool for pancreatic cancer. Now, you've probably heard of lateral flow technology with its renowned applications in COVID-19 testing and pregnancy tests. Implementing lateral flow presents promising advantages such as being rapid, inexpensive, and non-invasive, done through the use of saliva. We've determined 5 salivary indicators that are heavily distinguishable in the oral cavities of early-stage pancreatic cancer patients. In order to detect these 5 salivary indicators, SALiFLOW employs a multifaceted, optimized, 5-phased antibody that selectively binds to all of these antigens in a simultaneous fashion. Thus, diagnosing these salivary indicators before visual symptoms present promotes the early detection of pancreatic cancer.
SALiFLOW's prime intended application lies in annual checkups done by primary care providers who will assess factors such as genetics, age, and lifestyle to determine eligibility for usage of the tool. By following recommendations for annual testing with SALiFLOW, the risk for false results is also eliminated. A patient's saliva is dispensed in the SALiFLOW test kit, and within 15 minutes, through antibody-antigen interactions, a test result is displayed. So, ta-da! A positive test result is displayed by 2 lines, while a negative test result is displayed by 1.
The pancreatic cancer diagnosis market holds an exceedingly high value at $5.3 billion in 2020 and is expected to grow at a CAGR of 7.3% through 2021 to 2027. SALiFLOW will generate revenue as early as the first year of deployment, with its extremely unique product offering in the rapidly evolving diagnostic market. A pilot launch will be done to cancer research institutes across the US, which provides a source of reliability for the extension to hospitals and physicians with the resulting product maturation. From there, it will be made available to pharmacies as an over-the-counter product. Further deployment in overseas and emerging markets will also be planned. With 44 million people undergoing annual physical checkups solely in the US, our goal is to target this market, covering just 10% of this market in the next couple of years. This is projected to be a sustained annual sale of 4.4 million units, generating an annual revenue of $657 million at $146 per unit.
In 6 months, we completed the major milestone of antibody optimization and engineering through in silico means of Phase 1 of this prospectus. Phase 2 projects obtaining the 8 through the Diamond Challenge as a pivotal means for in vitro development of the antibody in the biochemistry labs of proteogenics. Phase 3 involves the fabrication of the lateral flow test in the medical laboratories of DC and DX, by which FDA-approved clinical testing of Phase 4 can thereafter be conducted. Through the mentorship of a cancer researcher, SALiFLOW's diagnostic capability is validated.
2 state funding rounds and a venture round have been planned for SALiFLOW development to improve accuracy, conduct clinical trials, and obtain FDA approval. Currently, half of the seed round of up to $50K has already been secured. We are expecting the annual growth in terms of sales by 1 to 4 times, as we will start with a minimum quantity of 10,000 units in the first half of 2023. With a projected decrease in unit sale price by 2% annually, $6 million in revenue in the year 2023 is projected, with a sale of 40,000 units. As the distribution expands to other outlets, we expect an increase in revenue to $290 million in 2025 with the sale of 2 million units. Ultimately, SALiFLOW's ability for early diagnosis paired with further screening enables the surgeon to resect the cancer-affected pancreas, preventing metastasis of the cancer, and thus curing the patient. Through its non-invasive use of saliva, application of precision medicine, cheap cost, long shelf life, and extensive manufacturing capabilities, it also eliminates immobilizing patient protocols, reduces chances of false results, is co-patiously affordable, and promises easy accessibility in developing countries, where access to in vitro diagnostic procedures is impeded. Through these benefits, SALiFLOW addresses challenges faced by its competitors.
Additionally, successful validation of SALiFLOW's diagnostic capability could promote the implementation of lateral flow immunoassays for various other forms of cancers, thus revolutionizing the cancer facade. I mean, just think about it. If SALiFLOW can diagnose pancreatic cancer early, how many other SALiFLOWs can be made?
With SALiFLOW, the thousands of other grandparents wishing to share music with their grandchildren, like Chester, are given the opportunity to defeat this cruel malignancy.
SALiFLOW. Capture the flowing truth. Thank you.